I want to get between your legs. Now that I've got your attention, this is why.
Did you know that you do not have the freedom to see a doctor or healthcare worker of your choice, or that healthcare workers are not free to develop the services that you need? I Want to Get Between Your Legs is a national public awareness campaign informing all Australians about how the Professional Services Review Scheme and Medicare are interfering with our healthcare. Every person in Australia is bound by the principles of natural justice, yet doctors, nurses and allied health can be prosecuted without evidence. Furthermore, there are no agreed clinical standards, so doctors can be prosecuted even though there are no set road rules. The injustice of the system has created audit fear in the healthcare system. Doctors are withdrawing or limiting services, referring patients and not taking a special interest in or investigating complex conditions in order to avoid being flagged by Medicare and dragged into court by the PSR. Being referred to the medical board due to a PSR inquiry could mean total deregistration for a doctor. This has created an intimidating environment and why you may not receive the treatment that you need. The Australian Constitution does not allow the Medical Healthcare Board, Medicare and the PSR to interfere with the doctor-patient relationship, yet the government have overstepped the boundaries of their administrative and financial role and are interfering with your healthcare. Recently, the PSR have lost federal court cases in which they've questioned the clinical care of patients. Your privacy is also at risk. With the introduction of the Healthcare Identifiers Act and the Personally Controlled Electronic Records Act, doctors are now required to upload your details and your clinical healthcare records to a national database. The government is interfering with your access to the treatment that you might need and your relationship with your healthcare provider. In the interest of your healthcare and the health of all Australians, we ask you to stand behind this campaign by joining our dedicated Facebook page and YouTube channel, and by liking, forwarding and sharing this video with your networks and your local politicians. Stay tuned and head to our YouTube channel as we flesh out the story in our special report, How the PSR is Impacting Your Healthcare.
A male doctor was doing more than examining the sore throats of the female patients. Well, what happened next concerned me more. 6 months later, we get a knock on the door by Medicare saying, look, doctor, you're ordering too many Pap Smears. Well, of course, it's a women's clinic. I had a client who, when we went and surveyed all the patients, the survey results came back and a male doctor was doing more than examining the sore throats of the female patients. So I was quite concerned and I thought, boy, that could be my daughter, my sister, my mother, my girlfriend, my wife. How can this go on? And I felt quite compelled to do something about it. I wanted to do something else and give women what they wanted. And that was the freedom of choice. And what that freedom of choice was, and what they asked for was they wanted a female doctor. Mm-hmm. Yeah. So we went out there and we got ourselves a female doctor. And we got a female doctor that was willing to do, the tears, the Pap Smears, And so basically those female doctors made the females quite comfortable in talking about those sorts of issues. It was the right thing to do, the right way. But what happened next concerned me more. 6 months later, we get a knock on the door by Medicare saying, look, doctor, you're ordering too many Pap Smears. Well, of course, we're going to order a lot of Pap Smears because it's a women's clinic. It defies logic. And in this country, when you get something like that, you're asked to pay back the money. And today, you can be deregistered for that. Mm-hmm. Scotty and all those guys basically said, what are we going to do about it? And we said, well, we need to have a Senate inquiry into the issue about doctors being, illegally prosecuted. So we got the Senate inquiry after petitioning that had happened. And then what happened next is that we were in front of Medicare and suddenly the Medicare watchdog had to basically explain himself to the 7 senators, and then we explained our side of the story. Then there came out a big Senate inquiry report with a number of recommendations, and it looks like the dog's lost its teeth. It sends a very interesting message about how government conducts its activities, whether it's open, is it fair, and is it transparent.
Have you ever wondered why it's so hard to get in to see your doctor of choice or given the treatment that you might need?